To make the prep easier, I always recommend patients to stay hydrated. It's very important. Although you're not eating anything, it's very important to make sure you're drinking plenty of clear liquids, whether it's Gatorade, water, Pedialyte, anything that is clear you can see through. It's very important to stay hydrated. We do not want you to get dehydrated. Once you do begin to drink the prep, you will lose a lot of fluids and electrolytes. So staying hydrated will actually help throughout the day. There are certain colors you will need to avoid: red, orange, or purple, just to make sure those dyes are not in the colon when we do the colonoscopy.
There are a number of things that the person can do to make the preparation easier. They can ensure that they hydrate themselves, that they drink water and other clear liquids almost in excess on the day prior to the exam. In addition to that, when you're actually consuming the preparation liquids, cooling it in the refrigerator beforehand may make the taste somewhat better. You can also add green or yellow crystal light to the preparation liquid to improve the taste. We have very important questions on what medications are appropriate before a colonoscopy. It's important that you take your blood pressure medicines and any heart medications prior to the examination. If a person has diabetes, we want them to speak with their endocrinologist or their general internist who manages their diabetes so that we can modify any insulin regimen or anti-diabetic medications that they may be taking. Finally, many patients are using oral anticoagulants such as Coumadin, Plavix, Xarelto, Pradaxa, and others. These medications generally should be stopped prior to the procedure to allow the complete removal of a colon polyp if it is found. It's very important that you and your cardiologist and your gastroenterologist coordinate the decision together as to when and whether to discontinue those medications. Completing a good preparation prior to the colonoscopy is very important, because if I can't see, I can't do a good job for the patient. If a residual material is left in the colon, it can be very easy to hide a polyp. And there are technologies that we have on the scope that we can essentially irrigate and help complete the preparation. But we can do that in a very limited fashion. And unfortunately, some patients have to come back and repeat their examination, repeat the preparation, if it wasn't completed properly the first time.
The prep in a colonoscopy is very important because it allows us to get a very nice clean look into the colon. We can comfortably and confidently say that we do not have any polyps or cancer if the colon is nice and clean. Also, if the colonoscopy shows that the colon is very blocked with stool, then we don't get a clean look. We may have to do another colonoscopy in a year or 3 years.